Good morning to you. This is talkRADIO Breakfast with me, Julia Hartley-Brewer. Let's talk more about that mandatory jabs for NHS staff. All staff, front line, back room staff. Everyone had to be jabbed. You have to have your first jab by this Thursday, or you would face being given your notice ahead of 1st of April deadline. That deadline, of course, much later than we saw with social care workers in care homes. They lost their right to work back in November last year. They, of course, many of those, thousands of those, lost their jobs. Many NHS staff already leaving ahead of that. But one of those who stood firm ahead of, that expectation of being sacked was Dr. Steve James. He's an NHS consultant anaesthetist at King's College London, and he basically very calmly, very respectfully and very fact-laden confronted the Health Secretary Sajid Javid on a visit to his hospital and asked him why he would be expected to get a COVID jab when he'd already had COVID, tested positive for antibodies and been exposed to COVID 1 million times, all while we were clapping for him a couple of years ago. Well, I'm sure Dr. Steve James would like to celebrate the victory on this policy, and he joins us right now. Good morning to you, Steve.
Good morning, Julia. Thank you.
It's an incredible U-turn that we are expecting is going to be announced today. It's not 100% confirmed, but certainly the papers reporting it seem very, very clear that it is what's going to happen. Why do you, first of all, your reaction to the news that it is going to be overturned, and why do you think it has been overturned?
Well, ecstatic about the news, and particularly that at least the Telegraph's initial report is that it's going to include care home workers as well. That's a recognition that the mandate is wrong and was wrong. So it was wrong to apply it for the care home staff when Delta was predominant, and it's still wrong to apply it, even more wrong to apply it now with Omicron. I think the evidence against the government, I've been sort of working on a three-pronged attack. One is the practical side. They've never won the argument to say it's a good thing for the NHS practically. Yeah. They've never won the moral argument. They know that the staff are against it from the beginning and the public have been against it as well. And the scientific argument has got weaker and weaker.
Yeah. Especially with the evidence. I mean, early on when we first had the jab with the previous variants, it did appear, the early evidence, again, it didn't bear it out, and it certainly hasn't borne it out with more recent variants, that you could have a much higher chance of not transmitting to other people. And therefore, I felt at the time that made it pretty sensible to get the jab in terms of not being able to put other people at risk. But that was also the case with people who already had COVID. And like you, I had the antibodies, I already had COVID.
Yeah, and for you, as we've discussed before, it was a choice. You weighed up what you felt was right, and you made a choice. No one forced you to have it or said you can't talk radio anymore. And that's very, very important. Yeah. Mandate.
The slippery slope aspect of this, I think, has concerned a lot of people. As you say, these reports saying this would affect the care home workers as well. So presumably that would affect care home workers who might be newly employed. But the reality is thousands of care workers either were sacked in the autumn last year or actually just left of their own accord for other jobs because they knew they would be sacked, who hadn't got the jab, even though they were those on the front line without often PPE, tending to our loved ones when we weren't legally allowed in to care for them in care homes. Should they reinstate all of those care workers who lost their jobs?
They absolutely need to reinstate all those care home workers. And there also needs to be work done now to look at the harm caused by this policy. Yeah. People who were unfairly dismissed, people who were coerced, and people who've suffered psychological issues as a result of it.
Yeah. But in terms of the motivations for this, why this has happened, is it because they realise, I think Sajid Javid is a very bright, very sensible guy. I worried he went a little bit native, as anyone who goes in the health department does, in terms of believing an awful lot of, frankly, the sage. I mean, proven to be nonsense, not my opinion, it's just proven to be nonsense, all of their modelling. But the idea that, have they come to their senses and gone, OK, this was a bad policy, morally, scientifically, it's not proven, we should stop this policy, it'll cause more harm to patients than by not doing it? Or have they been pushed into this by the fact that the NHS would be in absolute crisis? You'd have far more treatments cancelled and operations delayed. You'll have the staff up in arms, and backbench rebel MPs furious about this and wanting this overturned. Has the government been dragged kicking and screaming to this position, or have they made a positive decision to overturn a policy that they now know to be wrong?
Well, I don't claim to be a mind reader, and we'll always be guessing at what their true motivations are.
What do you think, though?
I think they've seen they can't get away with this, and the public wants an open debate. They want the information available about vaccines.
Why is there so much pressure? Is this sort of the public having been scared out of their wits with some, frankly, quite false information about COVID, demanding it and wanting it? Because I don't know any parent who wants their kids jabbed.
I think it's a monocular view about how to benefit society that a single drug or vaccine can bring about. It's a silver bullet, and simply more of it will be better.
Yes,
and
you had all your freedoms taken away. We had a terrible time. But if everyone's jabbed, suddenly everything comes back. Now, we've had that message for a year or so, and we're constantly under threat of another lockdown.
And the public knows it just doesn't make sense anymore.
Yeah. Well, I mean, I have to say, I know my listeners would want me to thank you for the role that you have played. I think so many people were willing to buy into the idea that anyone not having the jab was a conspiracy theorist, was a lunatic who didn't know, ignorant. That nobody, including the Health Secretary, Sajid Javid, when confronted by you in such a measured, respectful and fact-based way, could play along with that narrative that it was, here was an ignorant conspiracy theorist being anti-mandatory jabs, not jabs, mandatory jabs. And you speaking up, I think, really, really turned the argument over. And I have to congratulate you and thank you for that.
Well, Julia, I want to thank talkRADIO because you've given a lot of airtime to people who wanted to speak out, to the Together Declaration, to NHS 100K, Workers of England, Jackson Osborne, who brought the legal case, all the members of public and the other professionals who stood up against this. It's been an enormous collective effort to bring this about, and it's a real sign of the power people have when they feel things aren't right.
And when they speak out, indeed. Well, we keep on fighting for sanity to come back. Dr. Steve James, you are a hero, I think, to an awful lot of people. And we were clapping for you 2 years ago. Thank you very much indeed for joining us.